What is impetigo in children? Have you ever noticed red sores or blisters on a child's skin and wondered what they could be? One common cause of these symptoms is a condition called impetigo. Impetigo is a highly contagious bacterial skin infection that mainly affects infants and young children, particularly those between the ages of 2 and 5. The bacteria responsible for this infection are usually Staphylococcus aureus, often called staph, and group A streptococcus, known as strep. Impetigo typically shows up as red sores or blisters, especially around the nose, mouth, hands, and feet. These sores can easily rupture, ooze fluid, and then form characteristic honey-colored crusts. It is important to know that the infection can spread quickly to other areas of the body through direct contact or by sharing items like clothing or towels. There are 2 main types of impetigo. The more common type is called non-bullous impetigo, which features small sores. The other type, called bullous impetigo, causes larger fluid-filled blisters, mainly affecting infants and young children under 2 years old. There is also a more severe form called ecthyma, which penetrates deeper into the skin and can cause painful sores filled with pus or fluid. While impetigo can be itchy and sometimes mildly painful, it is generally not serious. However, it is essential to treat it promptly to prevent spreading and complications. A healthcare provider usually diagnoses impetigo based on the appearance of the rash, and lab tests are rarely needed. Treatment for impetigo involves antibiotics. For mild cases, topical creams can be applied directly to the affected skin. For more extensive infections, oral antibiotics may be necessary. Topical antibiotics help the sores heal faster and reduce the risk of spreading the infection. It is crucial to complete the entire course of antibiotics, even if symptoms improve early, to prevent the infection from returning. In addition to medication, keeping the infected area clean is vital. Washing hands frequently and covering the sores with a bandage can help reduce transmission. Children with impetigo should stay home from school or daycare until they have been on antibiotics for at least 24 hours and are no longer contagious. In summary, impetigo is a contagious bacterial skin infection that causes red sores and blisters, mainly affecting young children. It requires antibiotic treatment and good hygiene practices to heal effectively and prevent spreading. If you suspect a child has impetigo, it is always best to consult a healthcare professional for proper diagnosis and treatment.